For neuromuscular electrical stimulation, I'd have the patient seated with their arm relaxed on the table next to the e-stim machine. I'd want to make sure there's no scar tissue in the area and that the skin does not have any ointments on it and it is cleaned and the skin is hydrated. And I'd also check the electrodes adhesive to make sure that it is still good. The electrodes would be placed on the muscle belly of the biceps, with one near the motor point of the biceps, which is kind of near the middle of the upper arm, and the other one would be closer to the elbow. Ideally, I'd be using larger electrodes to prevent discomfort, and one of the options for this is the patient could also flex their arm in combination with this electrical current to kind of help facilitate the contraction. I would let the patient know that there may be some discomfort and that to let me know if there is discomfort, a feeling of burning, something like that. So I would stop and either lower the amplitude or we just stop the treatment completely. For education, I would let them know that the electrical current is helping contract the muscle and promoting blood flow to the area, and that long-term use of this could lead to strengthening of the muscle. And we can do this as just the stimulation alone, or we can add an exercise just to kind of speed up the process. And we are doing this to help strengthen this patient's elbow flexion, and that it's right now that the motor control for it is not very good, and we're trying to get that back. And this works by using your arm, by causing your arm to contract, and it will strengthen over time in combination with exercise. For the parameters, both electrodes would be on the muscle belly of the biceps. One is going to be near the motor point again. For the frequency, it would be 30 to 35 hertz at 400 microseconds with a 10 seconds on, 10 seconds off, and we do a 30-minute session with that to try to get a bunch of contractions in. For observation, we are going to be looking for a contraction. Make sure that the electrical current is not uncomfortable to the patient, and watch out for like burns and skin irritation. For documentation, we would want to do area treated, what position the patient is in, the parameters for the e-stim, how long we're doing it, where the electrodes are at, and the patient response.